Today we are going to talk about vascular ultrasound evaluate pseudoaneurysm surrounding injection pre and post. The pseudoaneurysm is one of the most common complications after patient has done heart cath or arterial cath for diagnostic or therapeutic intervention. Pseudoaneurysm was identified as an extravascular cavity exhibiting flow and communication to the femoral arteries through a connecting path with a characteristic to and from Doppler pulse wave signal. After heart cath, if patient gets pseudoaneurysm, the ultrasound gas surrounding injection is a safe and effective initial treatment, especially it has high successful rate treating lower extremity pseudoaneurysm. You can see this picture demonstrates the pseudoaneurysm. This is the pseudo, this is the neck, this is artery. And the risk factor includes the body mass index, gender, degree of arterial calcification, proportional platelet counts. The symptoms include groin pain or burning, swelling at the insertion site, and systolic blood, pulsing mass, hematoma, cold extremities, loss of pulse, and bleeding. There is a patient, she is 91 years old, female, with a past medical history of CAD. After her heart cath, during the vascular ultrasound exam, vascular ultrasound tech detect a pseudoaneurysm is in her left groin area. Pseudoaneurysm measure as the 1.9 centimeter times 1.3 centimeter, with the neck measure is 0.4 centimeter. This figure demonstrates the first day duplex ultrasound image show the femoral pseudoaneurysm, and the ABI remain the ABI is moderately reduced, and after she got successful duplex guide surrounding injection, there is a result hematoma that measure as 5.7 centimeter times 2.7 centimeter times 5.9 centimeter. The ABI didn't change. The next day, the vascular tech do a vascular lower extremity arterial duplex exam, limited exam on her again, and notice that there is a multi-chamber pseudoaneurysm, most thrombal in her left groin. The first measure is 1.5 centimeter times 0.8 centimeter. The second measure is 0.9 centimeter times 0.9 centimeter. The third appears to be partially thrombosed with open portion measuring 1.3 centimeter times 1.7 centimeter. There is the left groin hematoma measure 2.2 centimeter times 4 centimeter. The ABI didn't change. Due to her age, vascular surgeon decided to monitor her instead of do the surgery. Ultrasound-guided surrounding injection is a safe and effective initial treatment for the femoral pseudoaneurysm. It has a high success rate in treating the femoral pseudoaneurysm formation. Generally speaking, if pseudoaneurysm is less than 3 centimeters, we only need to observe it. But in this patient, pseudoaneurysm are bigger than 3 centimeters. Although the femoral pseudoaneurysm formation is rare to happen after ultrasound guide surrounding injection, but it happens on this patient. Additional observation and follow-up ultrasound study is scheduled and will help the developing monitor in patient situation in the future. The diagnostic ultrasound perform an important role in evaluate the pseudoaneurysm. It reveals blood flow waveform in pseudoaneurysm, color flow, and spatial Doppler were present in the study to demonstrate the condition of pseudoaneurysm. We can see the diagnostic ultrasound make a valuable evaluation, help doctor to make a correct decision. I have 5 questions about my study. The first is, do you know what is the risk factor of the pseudoaneurysm? The second one is, can you tell me 3 symptoms of pseudoaneurysm? The third one is, do you remember if pseudoaneurysm is less than how many centimeters, we only need to observe it? The fourth question is, do you know the typical pseudoaneurysm pulse wave Doppler wave count? The fifth is, do you know what is the safe and effective initial treatment for pseudoaneurysm? Thank you.